If you're building your ABA company and you're tired of guessing, this is for you. We built the EBCBA blueprint to give you real structure, systems, and support without the fluff. Details are in the description.
Hey everybody, Derek here again with Kay Ward. This is Kay's second visit with us, and Kay is the co-founder of CredAlt. CredAlt fills some really great gaps. My favorite gaps that it fills are the communications between billing company and the ABA provider, security-wise, workflow-wise, eliminating human error. It's a really cool platform. Any business needs to know who their ideal client is, exactly what we're doing. Who are the people who I can help the most, identifying them, breaking that down, and making sure that our business is designed to best serve them and accomplish our mission through those people. But in the ABA field, we have this other relationship, and that is with the people that are actually paying the bills, our payers. And today, Kay is going to go over payer market analysis, timeline management, and growth planning so that you can work with the right payers to fit with your business and your growth strategies. So, Kay, with that, thank you again. Take it away.
Awesome. Thank you, Derek, so for that intro. Hello, everyone. I'm Kay, as Derek introduced, and today we're going to talk about how to change how you think about insurance networks. So by the end of our time together, you'll not only have all the pieces, you'll know exactly where they should fit. So whether you're just starting out your ABA practice or you're looking to grow an existing practice, what we'll discuss today will help you build a stronger, more sustainable practice. So I want this to be as interactive as possible. So please feel free to drop your questions in the chat as we move along. So think of this like in live session, but also an interactive lecture. So as per the beautiful intro that Derek gave me today, so for the past 16 years, I've dealt with denied claims, confusing credentialing processes, and fighting with insurance companies. But here's what makes my experience super unique is I've worked for practices of all sizes, from single provider clinics to large healthcare systems such as Sutter Health in California, Baylor St. Luke's in Houston, Texas, just to name a few. I've built credentialing workflows and I've developed provider enrollment SOPs that generally save time and reduces major credentialing headaches. So you can think of me as your guide. If you made any mistakes, you no longer have to in payer credentialing. So what you'll learn today is I've built the session today around 3 powerful pillars that'll transform how you handle insurance in your practice. So first, we're going to dive into the payer landscape. So imagine you're planning to visit a city, you want to know more about it, where are the best neighborhoods, how do you get around? That's exactly what we're going to learn today about the insurance world. And then secondly, we'll master evaluating payer partnerships. So that's similar to like choosing your best business partners. You'll need to know who's reliable, who's going to pay you well and on time, and who's the easiest to work with. So we'll develop a high level system for making those crucial decisions. And the last thing we'll discuss are going to be things like efficient credentialing, what works best, cutting those processing times in half, reducing denied claims, creating systems that help you run your practice smoothly, and how you can save hours of administrative work. So by the end of our session, you'll have practical tools for each of those areas. So who's this for? So this is going to be for any ABA providers. So if you're on the front line working directly with patients, you're going to want to understand how insurance works. And so that means that you'll have more time helping your patients and less paperwork. And it's also going to be for provider enrollment specialists, practice owners, and no matter what role you're in, the information we're going to cover today will help make your job easier. So what I like to do is a little icebreaker. So in the comments, if you guys know when the ABA practice was introduced, please drop your answers in the comments right now. I love to see a little history moment in this webinar today. So if you have any idea, put in 1 for mid 1940s, 2 mid 1950s, 3 mid 1960s, or 4, I don't know. I just enjoy what I do. And so I'll wait for a couple of answers to come through. Have late 1960s, 1950s.
I
If
love
you
the
have any,
Kermit the Frog, by the way. Amazing.
it came out super blurry, but we'll just wait patiently. This is my favorite meme that I love. Alrighty. Alrighty, we got 3 coming in. So the answer is the mid 1960s is when it actually all began. And we've come so far today from a field that insurance companies didn't even recognize to one that's now mandated in most states. And I believe that is significant process for the ABA practice. So these numbers here on the screen tell a powerful story. 1 in 36 children has been identified with autism spectrum disorder. So in a major city, we're talking thousands of families. But the most crucial part is children in lower socioeconomic status neighborhoods have the highest prevalence. That is why understanding insurance, especially Medicaid, is going to be so important. It's not just about running a business successfully, it's about also reaching every family who needs help. So mastering payer networks increase ABA practice growth. So you want to think of your payer networks like building a strong foundation to the viability of your practice. So let's break that down on actually what that means. So what is a payer network, right? We'll make this super simple. Payer networks are like, think of them like gyms. So you have the insurance company that's like the gym owner. Then you have yourself, the provider, which is like a trainer. And then you have your clients, which are like your gym members. And the contract that you receive from insurance companies is going to be like your membership agreement. So when CMS defines a payer network as a list of doctors, other healthcare providers, so PAs, ADAs, NPs, psychiatrists, all of those, and hospitals that have plan contracts with, they're making it sound a lot more complicated than it really needs to be. So it's just a list of doctors and a network that allows providers to see members and provide care to those members. So here is examples of those payer networks. So commercial would be your Aetnas, your Cignas, United Healthcare, Optum, to name a few. Government would be those Medicare, Medicaid, and TriWest networks. TriWest is a little wonky. It is a governmental payer. And then you have private insurances, which are like HMOs, PPOs, fee for service, contingent on the type of payer that it is. Now, these are mostly plans that are purchased through your employer or an employer of your patient mix. And those private insurances are usually a little bit flexible and often a little bit more easier to work with. Now, their rates and their rules are very widely, but it's great for building local presence in your area. So the first thing you want to understand is, what do your patient demographics look like? So patient demographics are like the GPS to your practice. They tell you where your families are coming from, the type of insurances they have, when they need services and where they need services, and what barriers that they face. So this is where everything comes together. So we want to align 3 crucial pieces. So knowing your patients, what are their insurance types? Where do they live? How close is your office to those patients? When do they need services? What are their barriers to care? And then how does that affect your payer mix how does your payer mix affect patient access? So you want to know, as far as your payers, who pays reliably, who has the fast processing, who's processing your claims fastest, and who needs more providers in their network. So you may come into an issue where you submit a credentialing application, that application is denied based on quote unquote no network need. And so you want to understand and keep track of those denials so you know where payers need providers the most and where they do not need them the most, or what they say. And the next thing you want to do is align your demographics with your reimbursement. So match your services to the community, what's needed in the community, the type of services that are critically needed in that area, that specific area. And you also want to balance financial health with your mission. And also, all that will help you create sustainable growth for your practice to continue to grow and continue to make revenue for your practice. So what's the importance of a balanced patient mix? So looking at these charts, government insurances usually pay the lowest, but there's people that benefit the most, or patients that benefit the most from having that sort of insurance. And then they have high complexity as far as an approval process. I don't know if you guys have ever submitted a Medicaid or a Medicare application, but it is extremely longer than a commercial application, credentialing application. Commercial insurances are usually faster to pay, whereas government insurances may be slower to pay. And this is contingent on the type of practice, the number of providers, those sorts of things. And then your commercial payers your patient volume may be a little bit moderate, depending on the area that you are in. And then you have those private payers where their reimbursement rates are pretty moderate to high. They're a little bit moderate complex to go through the claim approval process. They usually pay a pretty good, and their patient volume is pretty good. And so, key insight on this entire chart is that a mix of Medicaid, private insurance, and direct pay options allow your practice to have more steady revenue if it makes sense. So it also just determines on, does this actually make sense for my practice? What is the value that I'm getting out of accepting Aetna over Cigna or Optum over Carelon, those sorts of payers? You definitely want to have that. You definitely want to have that payer mix if it makes sense for you guys, for your practice. Then, so how do you evaluate the best payers for your practice? So this will take some detective work. And then when you're choosing those payers, you want to ask yourself 3 questions. First, you want to analyze those reimbursement rates. You want to know, what do they pay for each code? How does it compare to the cost of running your practice? Is it even enough to keep your lights on? That's super valuable and super important when you think about cost, evaluating cost. So it'll determine if you need to hire another clinician or if you need to hire another ABA. Those things are important. And is it valuable enough to keep this payer in my mix, or if it's okay to just let it go? Then the next thing you want to do is assess the claim processing time. So in your contract, there is timely filing guidelines in every payer contract. So you want to make sure you are reviewing those guidelines per payer. And you want to know, how do they pay? Are they paying you within 90 days, 60 days, 15 days? How often are they denying your claims? Are they denying it for nuanced reasons? And what's their appeal process look like? You really want to know the appeal process when it comes to defending claims. So if your claims are denied, what do I have that will make the payer pay? And then just evaluating the administrative burden. How many hours are you currently spending on paperwork to even get those claims submitted to the payer? Are they requiring extra documentation? How does their portal look? That's a super important and strategic piece because each portal is different for each payer. So is their portal easy to navigate? So those are things you want to consider when you are evaluating who do you want to keep in your payer mix, because any contract you accept, you're adhering to their guidelines. So if you decide to not even see any of those patients, or it's not making sense, all of that thing, all of those things should be communicated prior to you signing any contract. Now, Medicaid and Medicare is pretty much non-negotiable, but if you want to think about your managed Medicaid plans, those are things to think about. So things like Aetna Better Health, that's one to name. That's a managed Medicare plan. So what are your next steps look like? You want to right now review what your payer contracts look like. So if you haven't looked at your payer contract since you've gotten started in your practice, or you're getting started in your practice, and you just want it all to make sense, you start looking at those things now. So pull all your current payer contracts, look at the payment times, check the credentialing standards. That's one key area that a lot of providers and practices that I've worked with in the past, they tend to forget to look at those credentialing guidelines. Contingent on state, Ohio is one of them that should be approving all provider enrollment credentialing applications within 90 days. So you just want to make sure that you are reviewing those payer contracts. And then the next thing you want to do is you want to monitor the claim processing times. How fast are they processing the claims? Does it make sense? And then you also just want to reassess yearly or annually, what do your paying demographics look like? I know a lot of providers that I know skip over this piece, and it's super critically important as you start to think about expanding your practice and adding more providers. You want to consider where your patients are, what insurances do they have, and are you missing any of those patient groups, or where can you expand in certain areas? And then you want to consider renegotiating your current contracts. So that means on an annual or even in a biannual basis. It just depends on how many members you're getting from that insurance company. So it's super important to be able to track all of these things. And this can be done via Excel spreadsheet or using some sort of software. Maybe if you have a practice management software, you can be able to manage these things within there as well. But it's really important that you look at these things on a annual or biannual basis. So every 3, 6, 9, 12 months, it's super important to reassess to see if that member base is going up, is it going down? What does that look like for your practice? And you want to just know how successful you are with that specific payer. And that's going to be your fuel to your fire to actually start renegotiating those contracts. So next thing is implementing a payer mix that is sustainable for your business. So similar to what we just talked about in the previous slides is conduct an audit with the current payers that you have. Drop those contracts that are not valuable for you, or see if there's ways that you can increase your rates by renegotiating. You want to improve your negotiation strategies by letting payers know that, hey, we have a high patient volume with you, and we want to see where we can increase some of those rates. And based on that, you just want to build a long-term strategy to plan for expanding. You shouldn't think like, tomorrow I'm going to hire a new therapist. It should be a well thought out process when you decide to make those important decisions. And then, so provider credentialing barriers. This is everyone's favorite topic to love or hate, but I'll make it as bearable as I can for you guys. So why is credentialing a critical business function? Credentialing can contribute to loss of revenue due to delayed care. It can disrupt everything that you have in your cash flow if you miss a recredentialing date, if you don't update your CAQH appropriately, if you don't communicate with payers that, hey, my practice has moved, my phone number has changed. These are all critical areas that could be reasons that your cash flow is disrupted. And then another critical function is credentialing can be an increased workload on your internal staff, making it super hard and super uneasy for you to be able to track those items. So those items. So expired documents, creating a digital organization solution or a system, and just having a checklist to be able to know what payers need when it comes to credentialing, know what they are going to ask for, keeping important things next to you. So your W-9, your CP7 575, which is your IRS documents, you're keeping your CV updated in month to year format, which is 2-digit month, 4-digit year format. That's super critical, important, and some payers will deny your credentialing application for that. All right, so here are our common credentialing bottlenecks. So these are the things that are going to keep you from advancing your credentialing application. So incomplete credentialing application. So it gets all the way down until where you have an address and there's a period in that address, but it's not referred to the payer. These are things that will cause your credentialing application to be denied. It will be denied. There is actually a law that's being regulated by Medicare and Medicaid based on this. So knowing that address has been verified by USPS is super important when you're completing these applications on these portals. The next thing is poor document management. Have a way to manage your documents, not just in any old file on your computer. It's important to be able to have those documents easily accessible in case someone needs them, a payer, an admin at your office, some things like that. You just want to make sure that information is readily available for someone. But also, credentialing has long approval wait times. I know if you've ever been credentialed before, you've waited anywhere from 60 to 120 days, even longer. I've known people that have been waiting on credentialing for about 60 days now, honestly. So it can take a long time, but it should not take that long. A thorough follow-up process is super important, making sure you're following up at the allotted time that payers ask for follow-up. So if they say follow up in 30 days and you're following up every 2 weeks, it could possibly be disbarred from their phone call tree. This has actually happened to me before a couple of years ago where I was following up too much. So yeah. And then payers have outdated processes. So you want to be super mindful that you have the latest updated application. If they want you to submit your application through a portal such as Availity, you want to make sure that you know all the ramifications around not submitting an application and the method that the payer recommends to process your application faster. So if you are a Medicare recipient and you complete a paper application versus their online portal, which is called PAYCOS, you just want to know that you're going to experience longer wait times. Way, way, way longer. And then, so how do you streamline credentialing for your practice's efficiency? You want to make sure that you're submitting all your applications. If you decide that you want to credential with 5 payers, it would behoove you to actually complete all those applications at one time. You want to make sure you're doing all those at one time so they can all come back with effective dates around the same time. And you just want to have a general way to standardize your document. CredAlt does that. We have a document management system, and the profile is free for all providers. So if you're looking for a way to manage your documents in one area and not on a file on your computer, and it's easily accessible for you, sign up for CredAlt, credaltapp.credalt.com, and you're able to sign up and manage your documents and track your licenses and stuff there. And then you just want to make sure that you're monitoring your status, your credentialing status in real time. So how do you optimize your credentialing strategy to reduce revenue loss? So credentialing prioritization is key. Start with your most highest value payers. Who's bringing in your revenue? Who's bringing in the most revenue for you? When you start to re-credential or renegotiate, this is super important. Making sure you're working on multiple applications at one time and keeping track of everything. And also be mindful of your recredentialing dates, because if you fall out from a payer, then it's going to be crazy to get you back into that network after you miss your recredentialing dates. And recredentialing happens every 3 years, according to NCQA guidelines. And then you should invest in some sort of technology, whether that be a smart sheet, whether that be an Excel spreadsheet, but some type of tech to be able to automate some of those follow-ups, or at least have you remember those follow-ups, reducing error and saving your staff some of that time. So you just want to be super mindful about how you strategically plan to credential. And that's pretty much all that I have for today. I would like to open it up for Q&A, and we can just start by reviewing exactly what we just covered, understanding payer networks and how they're important, evaluating those partnerships and renegotiating any payer contracts that you currently have, streamlining credentialing, and several implementation strategies. So what question, I would love to open up the floor right now for any questions that you guys may have. You can drop them in the chat, and I would love to answer them for you.
Okay, I'd love to hear you drill into the contract negotiation process a little bit, and knowing that you have a wider perspective than just the ABA industry. I think you bring a lot of additional value to the context of the ABA therapy businesses, because there are certain things that maybe haven't been introduced widespread in the ABA market that maybe should be a practice, that other markets are used to, dentists and doctors and, that kind of thing. How do we start the process of negotiating our contracts to get higher rates, and how do we plan a long-term negotiation plan to eventually get to where we need to be?
Yeah, that's an amazing question, actually. So usually the tactics that we take, and you guys are getting a free gem here. This is actually going to be my full-on process that I take to renegotiate contracts. First, I start with the contract. I go through that contract thoroughly with a fine-tooth comb. I start with credentialing turnaround times. I start with the current rates of that contract. And then once I have a complete understanding of that contract, I use that to go across all my top 5 payers. So what that means is, and it doesn't have to be top 5, but it'll be your top payers. So what that looks like, I take and I comb. Maybe Aetna is paying me higher than Cigna. So that's going to be my fuel to my fire for Aetna, because, or Cigna, yeah, Cigna would be paying me less. So that would be my fuel to my fire for Cigna to say, hey, I have a much better rate with Cigna, and I have the same patient mix where there's the same patients that are coming in the area. And I would take all of that information and I would create what's called a renegotiation packet. So if you have any certifications, any specializations, if you're the only provider in a 20-mile radius, all of that is going to be key to you renegotiating your contracts. The type of patients that you see, the socioeconomic value, the socioeconomic makeup of those patients, that's going to be critically important for, especially for your Medicaid and your managed Medicaid markets. And you can't renegotiate with Medicaid or any of that, but that there are plans that have those products attached to them. So you may be in network with Optum Medicaid products. That's going to be your area where you want to see an increase for a lot of those contracts. And then I just kind of seal the deal with actually going through and presenting a spreadsheet of what that's like across the board for all of my major payers. So I include patient mixes, I include any additional practice locations where I intend to expand, or where the practice intends to expand the next month to 1 year. I include all that in the renegotiation packet. And then what I do is I contact the network representative, or they may be referred to as provider representative or network representative, contingent on the payer. And then I take that and I submit it all to that specific contact. And then I just cross my fingers and hope that it all goes through. And then just having strong negotiation strategies, using some softwares that you can compare with other providers that are getting a higher rates than you in a certain market. You just want to know where you are and what that market contains and what can be done. And a lot of that research can be just done via Google or going out to the CDC to compare some of that good information.
So what I'm hearing is it's very important to have your marketing game together because you're going to need to market your business and show your value and your specialties to that insurance payer, and make sure that you're presenting them with a case where, hey, we need to get a higher reimbursement rate. And this is why you want to keep us as a provider and keep us in network. Really great. But this is something that's going to come out of your organizational strategy. This should be part of your business plan, your expansion plan, how you're building those renegotiation packages, and you're pulling this out of all your existing procedures and your organizational strategy documents to say, this is our mission, this is our ideal client, this is who we're dealing with, this is our expansion plan. So great advice. So how do you apply, like I always use the Pareto's rule, looking at clients, right? You're generally going to get 20% of your revenue from 80% of your clients and the other 80% of your revenue from the other 20% of your clients. And I think it's important to look at your payers in the same way. If anybody's going through that, and it's sometimes even more drastic than 80-20, like 90-10 or 95-5, right? So, look at that ratio, identify the payers who are in that area that you want to work in, and the ones that you don't want to work in, and analyze them based on, the amount of difficulty in getting paid, how long they take to pay, just like you're talking about building your payer portfolio, but looking at them in different aspects, right? Like how difficult it is to get paid from them, what areas are covered, the clients, all that stuff, and break down like what are your favorite ones to deal with. 80-20 rule. You're going to get 80% of your problems from 20% of your clients. You're going to get 80% of your billing issues from 20% of your payers, right? So look for those ratios and figure out the good and bad and see what you can balance out. So one example is if you've got a customer, or if you got a payer who is in that problem group where you get 80% of your problems and they're in that 20%, but then you look over on your revenue and your profitability side and you figure out that, hey, this is in my low profit group, right? I'm getting 20% of my revenue from this 80% of payers. So they're in both of those kind of bad groups. What's my next step? Promote them, right? Promote them in one of the groups. So get them into that group where you're raising the revenue up by raising rates and renegotiating. Or if they're in both bad groups and you can't afford to keep them around, we certainly don't want you paying money out of your pocket every month to service a certain payer, right? So these are all things that you want to look at and kind of measure out and kind of build your own little scoring system where you're always looking at these. And if they have a low score as quality of payer and a low score as profitability, see if you can increase that profitability where it makes sense.
Yeah, exactly what you said there. All that is super important information. And I like what you said about actually turning yourself into a marketing person, because that's exactly what you have to do. You need to be able to advocate advocate for yourself and your practice, and where does it make sense for an increase. I recently had a client come to me and he was like, Cigna's rates are terrible. I don't know what to do. I don't know how I'm gonna pay my providers. And I just said, well, does it make sense for you to take Cigna, or can you support or supplement that income from somewhere else? Maybe you can do cash based, or maybe you just pick another payer that's in your area that can help you supplement that income. So it's just super important. And then making sure you critically scrub those contracts to make sure they're adhering to their guidelines. And if it gets to the point, file a complaint with the insurance commissioner. It's totally your right to be able to do that if they are not abiding by their guidelines that they adhere to in their contracts. It's super simple. I've done it for several payers and they eventually get their act right. So don't neglect the options that are out there for you to be able to make sure your practice stays sustainable as you're venturing out into private practice, or if you're already there but you're seeing some bottlenecks, being able to come up out of those bottlenecks and actually make sure that you're doing what's sustainable for your practice is super, super important.
Okay, I hope I'm not over asking, but it would be great to do another live stream just focused on building that renegotiation package. Because that's
Oh,
something.
I would love that. That's actually going to be something that's involved in our next live stream in about 2 weeks here. So I'm going to be
Awesome.
diving deep into that renegotiation packet and how you can win over some of those contracts. And if they say no, the first negotiation, right? You send it out and then like, oh yeah, well, we don't really care, but okay, well, I have more fuel to my fire. And you're just going to have to tell me no. And then being able to go beyond if it's really valuable for you and that contract is super valuable to have and keep in your payer mix, you have to be able to go above and beyond. If that means going to the VP of Cigna, or whatever, maybe not that far up, but if that's what it means to you and it's valuable for your practice and for taking care of your patients, because patients care is number one, and advocating for the care of those patients and being able to still care for them in a manner that you can feed your family. So that's super important to be able to do.
Okay, we're so blessed to have you here in this group, and thank you for sharing your time and your expertise so freely. And again, it's so nice to have kind of a broader perspective than just the ABA therapy sector, being able to bring in those kind of outside influences in other areas of the medical billing to kind of give us something to measure ourselves up against, right? Because
Oh,
dentists are doing this. Doctors are doing this, nurse practitioners are doing it. My wife's a nurse practitioner. They renegotiate rates. So we need to make sure that we're doing the same thing for our AB therapy businesses. So, but again, Kate, thank you so much for your time. Thank you, everybody. This recording will be up on the group today or tomorrow. And I hope everybody has a great week. And Kay, we'll see you on the next one. Thank you again.
awesome. Thank you so much, Derek, for having me today. Thank you, everyone, for attending. And I look forward to seeing you in the group.
You're already doing the work, investing your time, your energy, and your vision. So let's make it count. Build something that works without breaking you. The EBCBA Blueprint is the way. Get started for free with our foundation course.